Good morning. Today we'll talk about HIV or human immunodeficiency virus. So regarding HIV or human immunodeficiency virus, HIV is the etiologic agent of AIDS or the causative agent of AIDS or acquired immunodeficiency syndrome. Okay, so at the end of 2015, year 2015, there are 36 million cases of HIV infection worldwide. And the problem with HIV, there is no cure uh, for HIV, and there is no available vaccine for HIV. And annually, there are 1.1 million new cases annually. So there are two types of human immunodeficiency virus. You have HIV-1 and HIV-2. Okay. Now, regarding HIV-1, there are four groups of HIV-1. You have M, O, N, and P. Okay, so majority of cases of HIV infection is caused by group M, HIV-1. Okay, majority. And under group M, we have 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 subgroups. Okay, so we have A, B, C, D, F, G, H, J, K. And the predominant subgroup of HIV-1 worldwide, it is C, and the predominant subgroup of HIV-1 in US, Europe, and Australia, it is B. Okay. The next is HIV-2. For HIV-2 is common in West Africa, and it's less pathogenic and it has lower rate of transmission. Is the HIV transmission. So for the transmission of HIV, first for the primary, you have intimate sexual contact, whether it's anal or vaginal. Then regarding the transmission of HIV, a disrupted mucous membrane increases the likelihood of transmission. So example, if you have syphilis, so if the person has syphilis, that increases her risk of or likelihood of or increases the likelihood of transmission. Another is gonorrhea, and herpes. It's because of the disrupted mucous membrane. Next is contact with blood and other body fluids. Okay, so example, blood transfusion, um, needle stick injury, that can also cause or one of ways to transmit HIV. The next is perinatal. Okay, so perinatal is from mother to child. So due to transfer of blood at the time of delivery or through breastfeeding. Okay, so in order to avoid perinatal transmission, um, the mother should um, take antiretroviral drugs and use infant formula instead of breastfeeding in order to avoid the transmission of HIV. Okay, so next is you have parenteral. So for parenteral, example is sharing of contaminated needles, blood transfusion, use of clotting factors by hemophiliacs, needle stick injury. And another thing about parenteral, no, regarding the transmission of HIV, the primary is sexual contact. Okay, then you can also transmit HIV parenterally. Now, another thing regarding HIV, you can also get HIV. Um, for example, if you go to barber shop or salon, and for example, in barber shop, if they're using the same uh, blade, okay, from one customer to the other, that can cause uh, transmission of HIV. Same with mani-pedi, okay. If they're using, I don't know the term for that. I think that's a pusher. Katong sharp siya na gina-use to remove debris. Uh, if that equipment is in contact with or naka-in-contact siya with the blood of a customer, then if you use that one to another customer, that can cause possible transmission of HIV. The next is transplantation. Okay, so next is the ways to decrease transmission of HIV. So first is screening of blood donors, and second, you also need to screen organ donors, okay, because HIV can also be transmitted via organ transplantation. The next is perinatal transmission. So to reduce perinatal transmission, first is you need to screen pregnant women for HIV infection. And if they have HIV infection, they need to take an antiretroviral drug. So the purpose of antiretroviral drug is to lower the viral load. Okay, so to decrease the viral load in order to decrease the probability of transmitting HIV from the mother to the child or fetus. Next is the use of infant formula. So the purpose of this one is to avoid the transmission of HIV via breastfeeding. Okay. The next is ways to increase the transmission of, or factors that increase the probability of HIV transmission. So first is exposure involving large quantity of blood or large volume of blood. So example, if you're going to compare the probability of transmitting HIV via blood transfusion and needle stick injury, so automatic, the blood transfusion will have higher probability of transmitting HIV compared to uh, needle stick injury. So reason, it's because of higher or larger quantity of blood or larger volume of blood. The next is patient is in the acute or advanced stages of infection. So during acute and advanced stages of infection, there is increase in the viral load. Okay, so increased viral load, increased chance of transmitting HIV. Okay, it's because during this stage, the patient is very infectious. Next is the probability of transmission. So if there is percutaneous exposure, it's 0.3%. So for example, a needle stick injury that has 0.3% chance of transmission. The next is 0.09%. That's mucous membrane exposure. So example, if this one, if you're always using your phone in the while working in the laboratory, so that can also cause transmission. So example, you have your serum specimen, then you handle serum specimen using while wearing gloves. Then after that, you hold your phone, you hold nimo. Then after that, you remove your gloves, then you hold your phone again. Then next is after that, imong detach imong mucous membrane, example your eyes, and that can cause HIV transmission, but the probability is very low. It's 0.09%. Okay, but there's still there is a possibility, okay, of HIV transmission. Okay, so that's why using phone in the laboratory is prohibited. Next is composition of the virus. So first it has RNA. Because it's an RNA virus, then it has reverse transcriptase. So reverse transcriptase transcribes viral RNA to DNA. Okay, so that is for the composition of the virus. So the important characteristic of the HIV virus, it contains reverse transcriptase. Next, you have the main structural genes in HIV. So first is the GAG, the ENV, and POL. So for GAG, it codes for the production of P55, which will further cleave into P6, P9, P17, and P24. And for these proteins, it is located in the nucleocapsid of the virus. So this is the gene. These are the proteins being coded by the gene. So this gene is responsible for the production of P55, P6, 9, 17, and 24. Next is the ENV gene. So it codes for the glycoproteins, and it's responsible for production of GP160, GP120, and GP41. And it is present or found in the viral envelope. So regarding GP120, it forms numerous knobs or spikes that protrude from the outer envelope, and it is important in the fusion and attachment of HIV to the receptor. So regarding the receptor of HIV, it is your CD4. Okay, meaning of CD is cluster of differentiation. So CD4 is the receptor of HIV. Next is the Pol gene. So it codes for enzymes necessary for HIV replication. So first is reverse transcriptase. That's your P51. So for reverse transcriptase, it is responsible for the uh, conversion of RNA to DNA, formation of DNA from RNA. The next is you have the ribonuclease. So it's important for the degradation of original HIV RNA. The next is the integrase. So integrase, it mediates the integration of viral DNA. So after fusion, after attachment, then next is after the transcription, after the conversion of RNA to DNA. Next is the DNA being formed will be integrated into the host genome, and that's the purpose of integrase. It mediates the integration of viral DNA. The next is protease. It cleaves precursor proteins. So this protein is important in the formation of a new virion, of a new virus. Okay. So after protease, after the activity of protease, then you'll form another virus or virion. Okay. Then it's located in the core. Next, you have other structural genes. So you have TAT, codes for P14, and P14 activates transcription of HIV provirus. Then REV, that's your codes for P19, it transfers viral mRNA to the cytoplasm of the host cell. The next is NEF, it codes for P27, it enhances HIV replication. Then BPU codes for P16, it's for viral assembly and budding. So this one is also important in the formation of a new virion. The next is VPR, goes for P15, and it's important in the integration of HIV DNA into host genome. Then VIF goes for P23. This is your infectivity factor. Next is the viral replication of HIV virus, or not HIV virus, but HIV. Okay, so human immunodeficiency virus. Okay, so for viral replication, first is the target cell. So the target cell of HIV, it's cells containing CD4. Okay, so example, you have your T helper cell. Okay, so the receptor, okay, of HIV, it is CD4. The target cell, the usual target cell, it is T helper cell because T helper cell contains CD4. Okay, so that's the target cell and receptor of HIV. Okay, next is for the successful fusion, okay, of HIV with the host cell. It needs the presence of co-receptor. So for the co-receptor, for T helper cell, it's CXCR4. Okay, and for macrophages, monocytes, dendritic cells, Langerhans cells, and microglial cells, it is CCR5. So macrophages, monocytes, dendritic cells, Langerhans cells, and microglial cells, they also contain CD4. And the co-receptor, or the co-receptor that promotes fusion of HIV and the host cell, In these cells, it is the CCR5. But in T helper cell, it is CXCR4, the co-receptor. Okay, so the function of your co-receptor is to promote fusion of the HIV envelope with the cell membrane. Okay, so if this is the cell, you have the target, the receptor. So for example, this is the T helper cell. Okay, so it has CD4. So this is CD4. This is the receptor and the co-receptor. So the co-receptor is CXCR4. But if this is a macrophage, so the receptor, same, it's CD4, and the co-receptor is CCR5. So the virus will react with the receptor, and the purpose of the co-receptor is to promote fusion. Then after fusion, next is the virus will be now in the cytoplasm of the host cell. Okay, so next is, after that, you have the conversion of DNA to RNA. So from RNA to DNA. Okay, and the enzyme needed in this conversion, it is your reverse transcriptase. So after the formation of DNA, the DNA of the HIV will be integrated, okay, sa host genome. So sa nucleus, transfer siya to the nucleus, and the DNA will be integrated with the host genome. Okay, so the enzyme needed in the step, it is your integrase. So the purpose of integrase is to integrate the viral DNA into the host genome. The next is you'll have the formation of mRNA. Then the mRNA will transfer to the cytoplasm. Next is you have the enzyme protease. So the function of protease enzyme is to form proteins that are important in the formation of a new variant. So after the formation of the new variant, or if the proteins important in the formation of new variant is available na, the next is you'll have budding. So ang budding is mag-extend siya, mag-extend, boom. Pag-extend, you'll have a new variant that is capable of infecting another host cell. Okay, so that's for the viral replication of HIV. Next is the defense mechanism of the HIV. So first, it is capable of rapid genetic mutation. Okay, that's why it's difficult to formulate vaccine against RNA. It's because of rapid genetic mutation. The next is down-regulate the production of class 1 MHC molecule on the surface of the host cell. So one of the functions of your class 1 MHC, it acts as a receptor of your CTL. Okay, so CTL is cytotoxic T cell. The purpose of cytotoxic T cell is to kill the infected cell. Okay, now the problem with or the one of the characteristics or one of the abilities of your HIV, it downregulate or it decreases the production of MHC1. Okay, so decrease MHC1 production, the CTL cannot recognize easily the infected cells because CTL is dependent on class 1 MHC. Okay, so it can recognize infected cell due to the presence of um, MHC class 1. So in HIV infection, you have decreased production of MHC. So it's difficult for CTL to recognize infected cells. Okay, then third is the virus is capable of having latent or performing or having latent infection. So it has latency. So it remains dormant inside the cell, and then it's and it cannot be recognized by the immune system of the host. Next, you have the effects of HIV infection on the immune system. So one of the characteristic of HIV infection, you have decreased CD4 cell. So this is the hallmark of HIV infection. Okay, so decrease CD4 cell and increase CD8. Okay, CD8, and we're talking about the T suppressor, not cytotoxic. Okay, so for CD8 containing cells, you have two types. You have the suppressor and the cytotoxic. Now, in HIV infection, you have increased CD4 count, but the T suppressor uh, count is increased. Okay, so decrease helper, increase suppressor. Okay, so regarding HIV infection, CD4, the reason why there's a decrease in CD4 cell, it's because CD4 cells is the target cell of HIV. Okay, because CD4 is the receptor of HIV. So you have decreased CD4. Now, regarding CD4 cells, okay, or T helper cell, the function of your CD4 cell is to produce interleukin 2. Okay, and the function of your interleukin 2 is to stimulate antibody production. Okay, another function of your interleukin 2 is to uh, give signal to your CTL that there is infection, because the function of your CTL is to destroy, okay, infected cell. Okay, now in HIV infection, you have decreased CD4 cells, so meaning you have decreased interleukin 2 production. Decreased interleukin 2 production, you'll have decreased antibody production and decreased activation of your CTL. So your body is not efficient, or it will not be effective in killing the antigen, which is the HIV. Okay, so we have decreased antibody production and decreased CTL activity. Okay, and it's due to the decrease in CD4. Okay, now another thing regarding HIV infection, you have increased CD8. Okay, diba? CD4, the function of CD4 is to tell your body that there is infection. Okay, CD8, it's the opposite. The function of CD8 is to suppress your immune system. Okay, so it's more ba siyang nihatag signal that there is no need na to fight infection. So in HIV infection, you have increased CD8. So you are suppressing your immune system. Okay, so decrease CD4, increase CD8, that's total disaster. Okay, so you have your immune system is not active na. Okay, it's because of the decrease in CD4 and increase in CD8. Okay, so if there's a decrease in CD4 cells, you have decreased function of B and T lymphocyte. So decreased antibody production and decreased activity of your cytotoxic T cell, okay, or CTL. Decreased effectiveness of antibody and cell-mediated immune response. So B is antibody, T lymphocyte, that's your cell-mediated immune response. And there is a decreased levels of cytokines. Example, you have your interleukin 2. Interleukin 2 is important in the activation of antibody production and CTL. Okay. Next is the decrease in CD4 cells is due to CD4 cells being killed by the virus via loss of plasma membrane integrity because of viral budding. So during viral replication, first is you have your fusion, then transcription, then integration, then next is the formation of new virion, and after that you have budding. So this process called budding that can cause um, disruption to your plasma membrane, and that can cause death to the host cell. Okay, Next is destruction of HIV-specific CTL. Destruction by HIV-specific CTL. So some CTL will recognize infected cell, and this CTL will kill the CD4 positive cell. The next is apoptosis. Okay. Then regarding HIV infection, it can also cause extensive damage to the lymphoid tissue, and there's also a decreased activity of the NK cells or natural killer cells. Okay, so clinical symptoms of HIV infection. So regarding HIV, it's a chronic infection that is characterized by a progressive decline in the immune system, and it's due to the decrease in CD4 positive cells. Okay, and regarding T helper cell, the body is responsible for the production of interleukin, which is interleukin 2, which is important in antibody production and activation of your CTL. Okay, so there is chronic infection because you have weak immune system. Okay, so for acute infection of HIV, you have rapid burst of viral replication before the development of HIV specific immune response. So you have increased production of HIV before the production of antibodies or HIV specific immune responses. The next is there is viremia or high levels of circulating virus, then reduction of CD4 T cell count, and during this stage it's usually asymptomatic. Okay, the next you have latency. So for latency, so first is acute infection, the next is latency. So during latency, your body is able to produce HIV specific immune responses. But the problem with antibodies against HIV, it's not effective because of the uh, capacity of HIV to rapidly mutate. Okay. Next is you have a decrease in viral load during latency or latent infection. Next is AIDS. So you have acute infection, latent infection, then AIDS. So for AIDS, you have profound immunosuppression with very low numbers of CD4 cells. Then there is resurgence of viremia. Okay, you have increased viral load. Now regarding CD4, there's immunosuppression because the CD4 activates your antibody production and your cell-mediated immune response. Now in AIDS or in HIV infection or advanced HIV infection, you have decreased CD4, very low CD4 positive cells. Okay, so your body will not be effective in producing antibodies or uh, activating your cell-mediated immune response or activating your CTL or your cytotoxic T cell. Okay, then it's also associated with life-threatening infections and malignancies. Then progression typically occurs in untreated individuals within the median of 10 years after initial infection. Okay, so if the patient is untreated, then AIDS will develop earlier. Symptoms of AIDS in infants. Okay, so for those infants with AIDS, you have failure to thrive. So meaning the baby is not growing. Okay, it's not gaining weight. Next is persistent oral candidiasis. Okay, this is a uh, fungal infection, a yeast infection. Next is there is hepatosplenomegaly, lymphadenopathy. There is recurrent diarrhea, okay, because the patient is immunocompromised, so he or she is prone to infection. Next is recurrent bacterial infection, same because of immunosuppression. There's immunosuppression due to the decrease in CD4 cells. Then there's also abnormal neurologic findings due to regarding the target cell of HIV. One of the target cells is your microglial cells. And if the microglial cells are infected, that can cause abnormal neurologic findings. Next is the HIV staging. So younger than 1 year old, if the concentration of the cell count of CD4 cells, it's greater than or equal to 1,500, that is stage 1. If 750 to 1,499, that's stage 2. And less than 750, that's stage 3. But for 1 to 5 years old, if it is greater than or equal to 1,000, that is stage 1. 500 to 99, that is stage 2. And less than 500, that's stage 3. Then 6 years or older, if greater than or equal to 500, that's stage 1. 200 to 499, that is stage 2. Then less than 200, that's stage 3. So the most severe, it's the stage 3. A reason, you have decreased or very low CD4 cells. Okay. Next is you have the indicators of stage 3 HIV infection. So for stage 3 HIV infection, first is we have bacterial infection, multiple or recurrent bacterial infection. Reason, it's because of immunosuppression. Another is candidiasis or persistent candidiasis. It's due to immunosuppression. Next is cervical cancer, then coccidioidomycosis, cryptococcus, cryptosporidiosis. So these are fungal infection. CMV. So individuals with HIV are prone to CMV infection. Next is HSV or herpes simplex virus infection. Next is Mycobacterium infection, Pneumocystis carinii infection, recurrent pneumonia, and Salmonella septicemia. So people with AIDS or people with stage 3 HIV infection, they are prone to develop fungal infection, viral infection, and bacterial infection, and it's due to immunosuppression. Next, treatment and prevention. So for treatment and prevention, supportive care of the associated infections and malignancies. Okay, so if you have pneumonia, then you need to treat pneumonia and also malignancies. The next is the administration of antiretroviral drug. So there is antiretroviral therapy. So the purpose of your ART or antiretroviral therapy is to suppress viral replication or to decrease viral load. Okay? So studies have shown that treatment with multiple drugs is more effective in killing the virus and avoiding viral resistance than treatment with single drug. So it's usually for treatment of HIV, it's a combination of 4 kinds of drugs. So example, you have nucleoside reverse transcriptase inhibitor, then non-nucleoside reverse transcriptase inhibitor, then protease inhibitor, and integrase inhibitor. Okay, so the combination of drugs from at least 2 of the antiretroviral drug classes, the term for that one is combination antiretroviral therapy or CART, or it's also known as your HAART or HAART, meaning highly active antiretroviral therapy. So the purpose of these treatment algorithm is to decrease the viral load. Okay, so it's a combination of multiple classes of antiretroviral drugs. Okay, so that's for the treatment, okay, of HIV. So the purpose of the antiretroviral drug therapy is to decrease the viral load. So effects, you have decline in opportunistic infection, so less chance of acquiring yeast infection, bacterial infection due to the antiretroviral therapy. Next is to delay in the progression to AIDS. So individuals who can afford to buy antiretroviral drug or antiretroviral or to undergo antiretroviral therapy, they have delay in the progression of HIV infection to AIDS, and it also decreases mortality. Okay, because if you have HIV infection at an early stage lang, then that's not severe. Di siya mga cause of death. Ang mga cause of death is it is AIDS. And to slow down the progression to AIDS, you need antiretroviral therapy. Okay, so that's why Magic Johnson is still alive. It's because of antiretroviral therapy. So Magic Johnson was diagnosed of having HIV infection during 1990s. Okay, Magic Johnson is a NBA legend. Okay, and since he's an NBA legend, one of the owners of LA Dodgers. Okay, so he has money to buy antiretroviral drugs. That's why until now uh, doesn't have AIDS. He has HIV infection but no AIDS. It's because of the antiretroviral therapy. Okay. Next, reduce perinatal transmission. Another effect of um, what you call this antiretroviral therapy. You have reduced perinatal transmission of HIV. So it is administered during pregnancy and labor and to the newborn during the first week of life. Okay, so purpose is to avoid perinatal transmission. Okay, now regarding perinatal transmission, diba, to reduce transmission, you also administer antiretroviral drug. Same principle lang na siya with, for example, if the woman has HIV, then the man kay no HIV. So to lower the risk of uh, transmission, okay, via sexual contact, um, the antiretroviral therapy can also lower the transmission of HIV via sexual contact. Okay, so because there's a decrease in viral load. Okay, and next, regarding survival time before CART, it's 26 weeks, and if you are using CART or survival time with CART, it is 50 years or longer because you're delaying the progression to AIDS. So regarding antiretroviral therapy like CART, it's not a cure for HIV infection. Okay, so it's a way of managing your HIV infection. It's a way of slowing down the progression to AIDS, but it's not a cure. It cannot eliminate um, HIV. The next is regarding vaccines not available, and main reason to that one is the rapid mutation of HIV. Okay, so next is the classes of antiretroviral drugs. Okay, so first you have nucleoside analog reverse transcriptase inhibitors. So regarding um, nucleoside analog reverse transcriptase inhibitors, they block the synthesis of viral RNA. Okay, that's the action. Next is non-nucleoside reverse transcriptase inhibitors. It inactivates reverse transcriptase, the enzyme that is responsible for the transcription of DNA to RNA to DNA. The next is protease inhibitors. So it prevents the cleavage of precursor proteins needed for assembly of HIV variant. So regarding protease, protease is important in the formation of proteins that are important in the formation of a new virion. Okay, so the purpose of protease inhibitor is to avoid or prevent the formation of proteins needed for the assembly of a new virion. Next is integrase inhibitor. So regarding integrase, the function of integrase enzyme is to integrate the HIV DNA into the host genome. So the purpose of integrase inhibitor is to prevent the integration of HIV DNA into the host genome. Okay. Next is fusion inhibitors. So for fusion inhibitors, it prevents the fusion of HIV with the target cell. Okay. Remember, the target cell are CD4 positive cells. Next is N3 inhibitors. So it block the binding of HIV to co-receptors. Okay. So regarding co-receptors, um, for uh, uh, T helper cell, it's CXCR4, and for macrophages, it's CCR5. Okay, so the purpose of N3 inhibitors is to block the binding of HIV to co-receptors, because co-receptor is important in the fusion of HIV with the host cell. Without the co-receptor, there's no fusion, no successful fusion of HIV with the host cell. So these are the examples of drugs per class. Okay, so for our examination, memorize the class and the mechanism of action. Okay. Okay, so next is the laboratory testing of HIV. So it plays a key role in establishing the initial diagnosis, and this is also important in monitoring the effectiveness of the antiretroviral therapy. So CDC recommends routine HIV testing for all persons 13 to 64 years old and annual testing for individuals in higher risk groups. So the purpose of these protocol is to avoid or to detect early detection of HIV infection, because it's not about sexual contact lang HIV. You can also get HIV from your barber shop, salon. It's due to the equipment that they're using. Okay, so if they're not following or if they're not doing autoclaving or proper sterilization of equipment, that can cause transmission of HIV. Okay, next is testing algorithm. So in 2004, the testing algorithm for HIV is, first you have screening. So for screening, you can check the antibody against HIV-1 and HIV-2. So you can use the testing kit. Okay, katong testing cassette for this one for screening. Then for confirmation, you're going to perform Western blot. Okay, so that's for the testing algorithm of HIV infection during um, or in 2004. Okay, so confirmation, the confirmatory test is Western blot. Next is the testing algorithm in 2014. So for the algorithm, first is to, or for the testing, first is to test HIV-1 and HIV-2 antibodies, and to also check for HIV-1 P24 antigen. Okay, so that's for screening. So there should be a rapid immunoassay that discriminates between HIV-1 and HIV-2 antibodies. Then any samples that are reactive in the initial test and unreactive in the second test should then undergo nucleic acid test to resolve discrepancy. Okay, so in the new testing algorithm, the first is antibody screening. Next is to identify whether it's HIV-1 and HIV-2 antibodies. The next is to confirm it using nucleic acid testing. So for the new algorithm, the confirmatory test na it's nucleic acid testing, not Western blot. Okay, it's because in HIV infection, nucleic acid is effective because there's continuous infection. Wala may treatment or wala cure man to HIV. So the antigen is always present. Okay, so you can always check for nucleic acid. So you can perform nucleic acid testing as the confirmatory test. Okay, so antibody and P24 antigen combo, you can use this one for early detection between 15 and 17 days of infection. And it overcomes the limitations associated with the use of Western blot test because in Western blot, it requires a lengthy, or it involves lengthy procedure. It is less sensitive than ELISA and performed only by specialized reference laboratories. But regarding nucleic acid testing, um, tertiary laboratories can perform uh, uh, nucleic acid testing. But for Western blot, it's usually performed in reference laboratories, and it's not that sensitive compared to, or it's less sensitive than ELISA, and it has a lengthy procedure. So the new algorithm, testing algorithm, first is you check the antibodies. And after checking the antibodies, next is to perform nucleic acid testing instead of performing Western blot. So for serological test, you can use ELISA. So it requires expensive instrumentation and skilled personnel with technical expertise and may have a turnaround time of few days. That's for ELISA. So purpose of ELISA is to check the presence of antibodies, okay, against HIV. The next is you have rapid tests for HIV antibodies. So this is your using testing kit. So it's simple. Rapid test results are available within 30 minutes. Then it detects antibodies to HIV-1 and HIV-2, and you can use the specimen that are acceptable for rapid test for HIV antibodies. You have serum, plasma, and whole blood. And primary use of HIV antibodies, rapid test for HIV antibodies, it is for screening. Then next is the Western blot. So purpose of Western blot is to detect antibodies against HIV antigens. So technically depending, but can give antibody profile of the patient. So if there's a presence of antibodies to P24 and P55, there's an early infection. And regarding these antibodies, it become undetectable as clinical symptoms of AIDS appear. Now, if the result is positive for antibodies against GP41, 120, and 160, these antibodies are a reliable marker of HIV infection. So it appears slightly later but remain throughout all disease stages. So antibodies against P24, P55, there's a possibility nga mo disappear or it's undetectable during the appearance of AIDS. But for GP41, GP120, GP160 antibodies, it usually remain elevated throughout all disease stages. So from early infection to advanced stage or the AIDS. Okay, so you have increased antibodies against GP41, 120, and 160. So regarding Western blot, for Western blot, you need a strip. This strip contains antigen. Okay, so for example, antigen to P24, antigen to P55, antigen to GP41, GP120, and GP160. Next is you allow this one to react with the patient serum. So patient serum contains antibody. So for example, if the patient serum contains anti-P24, anti-P55, so the antibodies will react in this region, in this area. Then after that one, you wash. Then after washing, next is to add AHG labeled with enzyme. Okay, so first, if you have the antigen on the testing strip, the next is you add the serum specimen contains antibody. The next is to add AHG, labeled AHG. So the reaction will be you have the antigen plus the antibody from patient serum plus AHG, labeled AHG with enzyme. Okay, so this one will react with in this area. Then after that one, next is wash. Then after you add the substrate for the enzyme. So after the addition of substrate, you have color development in this area. Okay, It's because of the reaction of the substrate and the enzyme. So if there is color development in this area or chromogen produced, then meaning the patient specimen contains anti-P24 and anti-P55, which is an indication of early infection. Okay, so I'll repeat. So example, uh, this area, it contains 160, then 120 antigen, then 41 P24 and P55. So this is the strip that contains antigen. So next is you add the serum specimen, which contains the antibody. So the antibody will react with the antigen. So for example, the patient serum contains anti-P24 and anti-P55. The next is wash, then add AHG. After the addition of AHG, the AHG will react with the antibody. So the reaction now is antigen plus antibody plus AHG with enzyme or label. And after that, you wash, then you add the substrate. Then the substrate will react with the enzyme. Then there will be color development in that area. So this means that the antibody, the patient serum contains antibody against P24 and P55. If there's a color development in this area, meaning there are antibodies against GP41, GP120, and GP160. That antibodies present in patient serum. Okay, so that is for Western blot. Next test is qualitative nucleic acid test. So this is highly sensitive and it's able to detect HIV RNA about 10 to 12 days after infection. So nucleic acid testing is very important in the detection of HIV. So for example, after needle stick injury, so you'll wait about 2 weeks. After 2 weeks, you'll be tested uh, uh, for HIV RNA. So reason why you can use nucleic acid testing, it's because ang atong ina-test is the presence of the RNA. Okay, so it's very sensitive. Okay, so the trend now is to use nucleic acid testing in the diagnosis. So in HIV, instead of using Western blot as the confirmatory test na in HIV infection or detecting HIV or diagnosing HIV infection, it is nucleic acid test or not. Okay, it's not Western blot anymore. Okay, so I think that's all regarding HIV. Thank you.